This is the lecture for the treatment mini lecture that took place on Wednesday, May 12th. When we talk about therapy, we talk about psychotherapy and biomedical therapy. Psychotherapy is psychological techniques performed by therapists to help with mental distress, while biomedical techniques are things like medication and other processes to address the biological nature of mental illness. Most therapists use a combination of both biomedical and psychotherapy. We call this the eclectic approach. Client-centered therapy is a form of humanistic therapy, which is all about boosting a person's self-fulfillment through growth. It's about improving the human itself. In humanistic therapy, in client-centered therapy, the client is designed to take immediate responsibility for their feelings and for their actions and not focus on hidden meanings. Client-centered therapy also focuses on the conscious thoughts, the present, and the future rather than the past. Client-centered therapy is called such because it is designed to be a team between the therapist and the client themselves to try to help them improve, with the idea that they're not unwell. And this is why they're referred to as a client instead of a patient. A client would be somebody who is trying to get better, whereas a patient suggests that there's something wrong with them, and that's not the idea that they want to have, that it's all about just getting better. Client-centered therapists use a technique called active listening, in which they have the client speak, and after they speak, they do one of three things. They may paraphrase, which is repeating it, kind of summarizing it, so that person's feelings are validated. I'm hearing you saying that this is and this and this what's happened. They might invite clarification. Well, what do you mean by this, this, and this? And then that the client can go a little bit deeper than maybe they would have before. And also, I understand that they would probably use something like a reflection of their feelings, where they might say, I understand that it makes you feel very upset, which validates how they feel. And a therapist in this situation needs to have unconditional positive regard in their environment, which is an environment that is judgment-free and ultimate acceptance. This makes the client feel valued. And ultimately, the goal of this therapy is for the client to move toward independence so they no longer need therapy. Group therapy is a type of therapy that involves one therapist and many clients. This can be helpful for one of two reasons. It can be helpful because the therapist can address more people, and at the same time can also, each individual can see that they're not alone. Family therapy is another form of group therapy. In family therapy, the therapist addresses each individual family member before addressing the family as a whole. And finally, we have self-help groups. And self-help groups are all about having group therapy without the therapist, where the older, more senior members mentor the newer members so that they don't make similar mistakes. When we talk about biological approaches to treatment, we look at psychopharmacology, which is medication that addresses mental illness. There are three types of drugs that we're going to address here. Antipsychotic drugs are designed to treat the hallucinations of schizophrenia. They work as antagonists because what they do is they block dopamine from stimulating the next cell, limiting the dopamine reactions that it can occur in someone's brain, which then causes the hallucination. Anti-anxiety drugs like Xanax or Valium slow people down because anxiety can often work people up to the point where they can't function. So it slows them down. This doesn't work all that well on its own, but in conjunction with psychotherapy, it can work very, very well. The problems with anti-anxiety medication is that they're very addictive, and it can lead someone to always needing to pop a pill as soon as they feel the first bit of unease, ultimately to the point where they need to pop a pill in order to feel normal. So many patients with anxiety are often prescribed antidepressants before anti-anxiety medication. And antidepressants work to elevate someone's mood. They are agonists, which means that they increase the amount of reaction of a neurotransmitter, in this case, serotonin, the neurotransmitter linked to mood. And they work kind of the name SSRI will suggest, which stands for Selective Serotonin Reuptake Inhibitor. So it stops the reuptake or reabsorption process of the neurotransmitters going back into their original cell, which allows them to react more and more and more, elevating a person's mood more and more and more. Finally, we have biological techniques like electroconvulsive therapy, which is designed to pump electricity to stimulate a person's brain structures. It can be a controversial technique because some people see it as akin to torture, but a person is usually given a sedative, so they're asleep while it happens. They don't feel any pain, and the only side effect is some minor memory loss. This is very good for treating major depression. It's very successful. Some people don't want to have the minor memory loss, so they may turn to repetitive transcranial magnetic stimulation, or RTMS, which does basically the same thing but uses magnetic energy rather than electrical ones. It's not as successful, but at the same time doesn't come with the side effects. And then finally, we have psychosurgery. And psychosurgery is a last resort. If none of these other options are working, sometimes doctors will go and cut into someone's skull and cut out or sever a portion of someone's brain to eliminate the things that are causing the mental illness. And that is where we complete this.